welcome back to the Can You Hear Us podcast. Today I'm joined by Cathy Alban-Jones, who's a nurse consultant at St Elizabeth Hospice in Suffolk. It's great to see you again, Cathy, and thank you for taking the time to talk to me today. We aim to provide lots of helpful information for people living with NF2 and bust some myths about hospice support along the way. I think that would be the best way to start, actually, because the word hospice carries a lot of negative connotations in our culture, and many of which are untrue. The biggest misconception about hospice is that they're just a place for people to go when they're ending the stages of their life. Although they're a place to support the dying, I know that they aren't limited to just that. So, Cathy, please could you go ahead and bust this myth? Who can hospices provide support to?
So, thank you, Jess. It's lovely to see you too. Hospices can provide support to anyone over 18 who are living with a long-term, life-changing and life-limiting illness. I think it's a common thought that hospices are only a place where people go to die, but there's a lot more that happens within a hospice than that.
Yes, thank you very much. So obviously that applies to anyone living with NF2. But I know that there'll be people who feel like their health isn't bad enough to receive support from hospice, or anywhere for that matter. I've heard things before like, there are people much worse than me, or I shouldn't complain. And things like that. So what would you say to someone who has that kind of mindset?
I think that anyone living with a life-changing illness, even from birth, will often feel that there's people worse off than themselves, but hospice care can be accessed at any point along someone's illness, and it's not a question of needing to be bad enough or have symptoms that are severe. It's about whether or not you need to perhaps feel supported and listened to, and also be able to access services which might help.
Yeah, that's so true. Although NF2 vary greatly in how we are physically affected, there are a lot of things that put us all into the same boat, and therefore should all be considered worthy of receiving support. Something we all share due to the nature of NF2 is uncertainty, which can invoke a lot of feelings that are difficult to live with, such as anxiousness, stress, powerlessness. How can the hospice help people to cope with feelings associated with uncertainty?
I think it's probably important that we build a relationship with that person and can support them to acknowledge that uncertainty, to allow people to be able to discuss their fears, their worries about the present and also the future, perhaps their worries about their family. Also to put plans in place if they're thinking about the future when they're less well. And there are things that a hospice can offer, such as complementary therapies and mindfulness, which can also help with relaxation and trying to feel better within yourself. But I think it's also about, the most important thing is developing the relationship of trust between you and the hospice, so that you feel able to talk and share those fears and be listened to.
Thank you for that. I understand that not all hospices provide exactly the same services, but am I right in saying that complementary therapies are quite a universal thing among hospices?
Yeah, so I would say that the majority of hospices provide some sort of complementary therapy, whether that's relaxation therapy, mindfulness, aromatherapy, reflexology, because what we know is that those therapies can help people to relax, both physically and emotionally, and that can also help with pain, it can help with sleep, and it can help with a variety of other symptoms as well.
Thank you. Something else I'd like to talk about is loss. Because everyone with NF2 will experience this on some level throughout their journey. When I say loss, I mean loss of abilities, hobbies, a career, or generally just life as we know it. With loss comes grief, which is something that hospices have a huge amount of experience with. So please could you talk about how grief, in the ways that I mentioned, can affect people's lives and how hospices can help with this?
I think you're right, Jess, and that's something that I've seen with you as well and experienced over the last few years, is how life changes when you have NF2 and how life needs to adapt to those changes. I think with every illness, there is an element of loss, and talking about this, talking about how you're feeling about those losses and changes and feeling supported doing that can help. Also, we can help support you in looking at, are there different ways of doing things? And being able to acknowledge that loss and share those emotions as well is very important. And there can be formal counselling if needed, or perhaps just having the opportunity to talk to someone on a regular basis and hopefully feel that someone is there listening and trying to understand what it's like for you.
Well, thank you for answering that so well. It helps to explain how, in my experience with the hospice, I felt like I'm understood there. Feeling understood when you have a condition like NF2 can seem pretty hard to come by even within close family units sometimes, which is a big part of why I wanted to raise awareness of hospice support. But I know that family members can also feel this way, and they also have to deal with a lot because someone they love has a life-changing illness. Can family members of people with NF2 also access support from hospice?
Yeah, so hospices look at the person with the illness, but they also look at those important people around that person, because what we know is that although the person living with the illness is the pivotal person, that illness affects their family, it affects their friends, and it affects anyone who really cares for them. So hospice services are open to anyone that's important to that person, and they can access services such as, again, complementary therapy, counselling and support as needed.
Brilliant, thank you for that. I would like to talk about your role at the hospice, or the equivalent of you at the hospices, because you've been a very valuable resource to me for almost 6 years now. So let's start from the beginning. When I first went to the hospice, could you tell everyone what happens on the first visit?
So on the first visit, what usually happens is that we go through an assessment with someone, and we look at both the physical symptoms that people might be experiencing, how they are feeling emotionally, how they're managing, and also their sort of social spiritual needs. We also then explain about what services the hospice can offer, and we can review any symptoms. And I think with you, there were some symptoms that you had with pain to start with, but then it's also about a discussion between what would be helpful at that time and what hospice services someone might want to access, and putting that in place. We can also bridge that gap between hospitals and the GP and the community services, and perhaps act as a link between all of them when needed.
Thank you. So you're sort of like the glue between the patients and the hospice, much like the NF2 nurse specialists are the bridge between us NF2 patients and the multidisciplinary teams and clinics. Please could you explain why it's so important to have that person as point of contact?
I think when you're living with a chronic illness or a life-changing illness, there are lots and lots of people involved, and the teams get wider and wider. So to have someone as a sort of link or initial point of contact that can then give you access to other teams and therapies as needed is probably quite important, because it's easy to get lost in hospitals and healthcare systems. And also to develop that relationship with one person so that you feel that they perhaps know you more as an individual and can then help to sort of guide you to what services might be helpful.
Yes, so true, thank you. It would be great if we could talk about the various things that you have supported me with in my day-to-day life, to really show people how beneficial it can be to have involvement with a hospice. So please could you share some of your experiences with supporting me?
Well, Jess, you are my first person that I've met with NF2, and you've taught me a lot about NF2 and about what people go through when they have this illness. I think hospices are generally places that are very good at managing symptoms, such as pain and nausea, but also hopefully being able to offer someone that emotional support and really walking alongside someone as they go through their illness. So there's been times when perhaps we've looked at your medication and we've changed your medication to relieve symptoms. There have been times when I've been able to liaise with other healthcare professionals to perhaps speed things up when you've needed to access their support. There have been times when we've been able to go through benefits forms and access financial support, and also write letters to support what you need at particular times. So I think hospices can provide a variety of support depending on what that person needs, and it's very much an individualised service, I would say.
Yeah, thank you. I'd like to speak with you a little bit more about mental health, because the hospice has been a huge help to me in that respect. It probably surprised a lot of people to hear that because of the big misconception and lack of awareness about what hospice can provide. So let's begin to change that by talking about how hospices can support people with their mental health and well-being.
I think that's really important, and I think it's probably something that we don't acknowledge enough, is the impact on someone emotionally and mentally of living with a lifelong illness, and also, as you've mentioned before, the loss and the changes that go along with that. So hospices have people like me who I guess have experience in helping people with life-changing illnesses and supporting them emotionally, but we also have counselling services if people need more than the support that perhaps I or clinical nurse specialists can give. And those formal counselling services can be really helpful, and our counsellors have a lot of experience again with complex long-term illnesses and with the loss that goes alongside those.
Thank you very much for that. There are a couple of other services I would like to talk about. Respite and Day Care. From my understanding, these services are for the benefit of both patients and the people who care for them. Please can you explain what Respite and Day Care involves and the benefits of these services on both sides of the coin?
So, hospices vary a little bit depending on what services they offer, but many hospices offer day care, which is the opportunity for someone to come to the hospice for a day, to be able to access the therapies that the hospice provides, such as physiotherapy, occupational therapy, complementary therapy, and counselling, but also to have peer support from perhaps other people who are going through similar experiences as them. So that's what daycare is, and people will tend to come in for 1 day a week for perhaps an assessment period, and then that will be reviewed. Respite care varies from hospice to hospice. Some hospices have an inpatient unit where we have beds where people can come in for a period of time and then be discharged home. And in some inpatient units there are respite beds where people can come in on a planned admission, perhaps to give their family or their carers a break if needed. The hospices that don't have respite beds, and we are one of those hospices, would always take people onto the inpatient unit if needed. So if people at home were struggling, that's a reason in itself for an admission to the inpatient unit. So it might not be termed as respite, but we can often enable people to perhaps come into the inpatient unit because there's often other things that are going on as well. So carers may need a break, but they may need more support, and the person themselves may find when they come to the inpatient unit that there's other things that we can help with. So inpatient units in hospices tend to be small, perhaps 18 beds, 20 beds at the most. And they tend to be reasonably short stay units, perhaps 1 to 2 weeks. And as I say, people will then be discharged home with follow-up from the hospice at home.
Lovely, thank you. Are there any other services that we haven't already covered?
So again, some hospices will be able to provide things like art therapy and music therapy, which can be really helpful sometimes if talking about emotions is difficult or challenging for people. There's another way to express it. Hospices also have occupational therapists and physiotherapists that can look at equipment that might be needed to enable people to be as independent as possible for as long as possible. We also have often spiritual care teams, which again can look at counselling. And I'm just trying to think of anything else, but I think we've probably captured most of that.
Yes, I think we have. So finally, I would like to go over some practical points for anyone considering hospice support. First of all, will all hospices be able to help people with NF2?
So I would like to say yes. I think there may be hospices that aren't familiar with NF2 and what it means. And certainly, as I say, I was like that to start with before I met you. But every hospice, I would hope, would accept a referral and meet with that person and look at how they can help support that individual.
Thank you. What happens if someone isn't able to get themselves to a hospice?
So if someone can't come to the hospice for an outpatient appointment, then often we can visit them at home. And sometimes if people live too far away or if they're unable to drive, then that's the first thing that we would do is visit at home. For some people that come to daycare and decide that they want to come to daycare, if transport is a problem, then that's something that can be arranged as well.
Thank you. So once people are set up at a hospice, is there a set amount of time that they can receive support before needing to be referred again, or is it ongoing?
So hospices work slightly differently. Once people are, if you like, in the system, once they're known to a hospice, then they can access it as they need to. So it may be that someone makes contact with the hospice, they have an assessment, and a plan is agreed for therapy or for support or for counselling. And after perhaps a few months, that person feels that they feel okay at the moment, and the hospice takes a step back. So the support is there for as long as people need. And if the hospice does take a step back, it only takes a phone call from you to start that process again. So once you're known to the hospice, you're in the system, if you like. And people can refer themselves to many hospices. Some hospices like the referral to come from their GP or from another hospital practitioner, but many hospices will accept a referral from the person themselves.
Yeah, thank you. The communication is a big worry for a lot of NF2ers. So you're able to reassure people that their communication needs will be met?
I hope so. I would say that we would never stop trying to help facilitate communication with people. And I know, and I'm hoping it's okay to say that someone who met you quite early on was able to help you with mindfulness, perhaps at a time when you weren't able to hear, and he adapted how he would usually do it, so that you were able to access that. I think that we will keep trying, and I think that's the biggest thing. I would hope that we would be able to work with anyone, whatever their communication difficulties. We're probably used to working with people with MND who use lots of adaptive technology. And part of that may be helpful when working with people with NF2. I think it's an ongoing discovery.
My last question. What is the best way for people to find hospice support?
So you can Google your local hospice. There's a Hospice UK website which lists all the hospices there are in different areas. There is usually a hospice that is local to you, and probably the internet is a good way to find that, or to ask any health professional like your GP or hospital health professional, and then phone.
Thank you. I'd just like to add that personally, I would recommend anyone living with NF2 to give hospice support a go. If you find that it's not suitable for you, then it can easily be stopped. But you never know how beneficial it can be until you try. I was very reluctant to try it at first, but now I can see that it was due to my lack of awareness of hospice support and the misconceptions surrounding it, which were holding me back. So I hope that this podcast has been informative, eye-opening and encouraging. A huge thank you to Cathy for taking the time to speak with this and provide such a clear picture of hospice support. Thank you, and goodbye.